We're live.
Good morning and welcome to a very special segment. My name is Jametta Lilly and I am blessed to serve as the CEO of the Detroit Parent Network. And many of you have been following the COVID313 Community Coalition for Families and Youth for now 18 weeks. And what we have been endeavoring to do is to continually bring you information, facts, resources, and support. And so today we're going to have two of our dynamic Zooms for you. Today we are partnering, and we're so delighted to have a partnership with Wayne State University School of Medicine, as well as with the Karmanos Cancer Institute, with the COVID313 Coalition. We are coming together today to take a deep dive into looking at racial disparities, the reasons, and hearing perspectives about this. This is only the first part of a two-part series we're going to bring. But keep in mind, we're going to be through at 11:30 in this part of our programming, and we welcome you to come back after an intermission to see a deep dive into education. So this morning, welcome to the Racial Disparities panel and the new partnership with the COVID313 Coalition, Wayne State University, and Karmanos Cancer Institute. And having talked about our wonderful partners, let me now introduce you to some of them. The very first one that we'd like to bring on is Dr. Haley Thompson. Haley is a magnificent community activist. I want to say that she is what I call an activist academic, but specifically she is the professor in the School of Medicine. She's also director of the Office of Cancer, Health, and Equity and Community Engagement at Karmanos. Haley, welcome, and talk to us about what do we mean when we say racial disparities?
Thank you, Jametta. We're really pleased to be a part of today's program. So if we can move to the next slide, I'll talk a little bit about first overview of just Wayne State University and Karmanos Cancer Institute's part in all of this. We are part of the Provost Social and Behavioral Determinants of Health Steering Committee. This is a group of faculty members at Wayne State University who have come together under the guidance of the provost to develop a community of scholars and also community partners to really address what we call the social and behavioral determinants of health. And I'm going to say a little bit more about that and explain what I mean or what we mean when we say that. We are trying to build awareness about this topic, expertise around this topic. We're trying to bring together resources around doing this work together. And we're really seeking to collaborate more across a wide variety of groups in doing this work in order to improve health outcomes, particularly health outcomes in metropolitan Detroit. Can go to the next one. Yeah, as I mentioned, I'm a member of that committee. I'm also a professor at Wayne State in the medical school in oncology, and I'm also an associate center director for Karmanos Cancer Institute. And specifically, I work with our community outreach and engagement component. And our role is to understand the needs of the patients and communities we serve. And we serve communities across half of the state of Michigan, 46 counties. Our job is to understand those needs and to make sure that the research that we do at Karmanos Cancer Institute and the services we provide are aligned and consistent with those needs, that we are meeting those needs. And we also want to make sure that communities have a voice in the work that we do. So in getting started here, I just want to talk a little bit about some definitions that we're going to be going through today. So the first is health disparities, which is a term that we hear a lot, especially in the COVID-19 era, right, with this pandemic. And so what we mean by disparities are differences in health and health outcomes and healthcare across different groups. And that definition has been updated somewhat because more and more we are recognizing that those differences are due often to things that put people at a disadvantage, either socially, economically, or because of their environments. And that really leads us to another term that we hear a lot these days is health inequity. We hear health equity and health inequity. And when we talk about those terms, inequity, that really just refers to those same differences in health and health outcomes. But we were, again, recognizing that these are differences that are not only unnecessary, but they're also avoidable and unfair and unjust. Okay. So we go to the next one. So I'm going to talk a little bit about the social behavioral determinants and social and behavioral determinants and causes of health. So here, when we talk about determinants, that's just another way of saying the causes of health, right? Or the causes of health outcomes. And sometimes a good way of describing this has to do with thinking about a river or a stream. And so let's think with that word downriver. We know that term a lot from our area, or downstream, right? So sometimes we talk about the downstream causes, which are really the things that are most obvious to us and the things that we really are more easily observed. You know, so these are the things that tend to be closer to our health outcomes and health effects. So sometimes they're genetic. You know, sometimes there are things, we have some things called genetic mutations that might increase our risk of cancer or increase our risk of other disease. Or there might be behaviors that we see being closely linked to a health outcome. So a really easy example of that is smoking, right? You know, smoking is a behavior and it will increase your risk of lung cancer and other types of diseases as well. So those are sometimes what we call the downstream causes, right? The causes of health outcomes that we can easily observe, and we usually observe them within individuals, right? Individual people. But we need to kind of think about that a little bit more broadly, because people don't just live in a vacuum. We live in families, we live in communities, we live in neighborhoods, we live in societies, and living in all these different contexts influences our behavior. It influences us on the individual level. And then we have to acknowledge that when it comes to health too. So where we talk about downstream factors, but we also have to think about some things that we can't as easily observe or see, which are more upstream. So we can go to the next slide. All right. So the upstream causes, sometimes we think about them as the causes of the causes, right? So the things that are not as easily observed, but they do influence us on the individual level, right? So those are things at the social level, the level of environment or economics. They can be ideologies. They can be political structures. We can think about our laws and public policy, our neighborhoods, the rules of institutions that we participate in, like the rules and the norms of hospitals and schools. Those are all things that we can't as easily observe, but they still affect our health on the individual level. You know, one of the things that we talk a lot about these days as an ideology is racism, right? We're hearing more and more about how the ways in which racism influences people's health on the individual level, whether it be in often, you know, the stress of racism that may cause people to engage in healthy behavior because they're stressed out, and that influences and can shape poor health, you know, or it can be through things that are more direct. Again, when we talk about now racism, there's a lot of conversation around police aggression, you know, and the violence there that affects individual health outcomes as well, right? And that's a way that racism can kind of work downstream, go from upstream to downstream and influence us on the individual level. So, and the upstream causes, those things that are not as easily observed, oftentimes are what we talk about when we say this term, social determinants of health, that can affect behavioral determinants of health. So that's what we're going to be talking a little bit more about today. So with that, I'm going to turn it over to Dr. April Valorand.
Thank you, Haley. We're excited about today, and we will be moving into a panel of parents that are going to inform us on the issues about what's going on in their world and get us started on thinking in those directions. So if they want to get started.
Yes, and thank you, April. So what we have always done is to make sure no matter what the topic is, that we are relevant in speaking to the families that we're here to serve. And who better to do that than parents themselves, particularly parents who have been trained and now are advocates for other families. And so what we're going to do is kind of change our flow a little bit. And I'm so pleased that we have with us is Christina. Christina is going to come to us from the Detroit Hispanic Economic Development Corporation. Christina, welcome.
Hi, thank you, Jametta. This is Christina. Yes, as you mentioned, my name is Cristina Ruiz-Mazon. I'm a parent educator with Detroit Hispanic Development Corporation. I am the daughter of Dolores Ramirez, Inocencio Virto Calderon, an adopted daughter of Trinidad Ruiz, who loved me and raised me as one of his own. I'm a second-generation immigrant with my mom. I lived through the hardships of seeing her being the first-generation immigrant. And I remember when she would come home, she was exhausted. She had no desire to spend family time. She felt isolated. She doubted herself because she didn't speak the language that her children spoke. She missed her culture. She missed her family. She felt ignored. She ignored her illnesses because she knew that we depended on her. And she had heard the horror stories of the healthcare system being so highly costly. She felt shame because she was called illegal, even though she had gone through the process of legalization. She was still being called illegal for taking jobs. I remember the day my mother had her citizenship appointment. In her application, she requested to be tested in Spanish. And when she was being tested, when we went in, the ICE officer told her that they didn't have a translator for her. So I offered to translate. As we walked in, he was taking his seat and he told her, Dolores, why have you never taken the opportunity to learn English? And as we sat down, I translated and my mom responded. When I was picking up oranges, I was picking up strawberries, mushrooms, or I worked in a factory as a seamstress. My English speaking bosses never cared of what I said. They only cared of how much I produced. Therefore, I never needed to speak English. And that was a moment of humbling for the ICE officer and a moment of empowerment to me. And she had, as I mentioned, she had been here in this country having those feelings of isolation. I continued to work with the Latino community, and we continue to see the disparities, especially during this pandemic. The CDC has stated that the Latinos are being hospitalized with the virus at a 4 times higher rate than white American. A lot of the factors is that we have multifamily households, and it's a tendency that we live this way because this is our community, or because we have limited access to healthcare. Language is always a barrier, just like my mother had found it in her life many times, and limited access to healthcare systems. Okay. Currently, there's hotlines, there's clinics, there's hospitals, and there's disseminated information to the Latino community, but many times it's not provided in their language where it's not a priority. It takes a couple of weeks to get those documents translated and then sent out. A few weeks ago, I tested for COVID. I was asked to bring my ID issued a document by the state. Obviously, I brought my driver's license. As I arrived to the site, there was 2 police officers and one military service gentleman guarding the testing site. I thought to myself, in this type of setting, if I'm intimidated, how could I send the families I work with to these settings? How could they even dare to come if they don't even have a driver's license? Because currently the state of Michigan denies to provide them with identification because of their undocumented status. Sadly, these disparities continue to isolate our Latino communities, making us feel like we don't belong here, but we're here, we're present, and we need to be taken care of too. So as a parent, as a person that works with parents, this is my testimony, this is what I see, and this is what I'm concerned on a day-to-day basis. Thank you so much, Shamara.
Christina, thank you. That was powerful. And this is what we consider to be a collaboration, a shared learning space, that we listen to each other from different races, from different ethnicity, from different social economic backgrounds, because we're coming to this shared space of learning so that we can empower our community to address the issues and create meaningful solutions for change. And while we talk about change, I'm always so pleased to bring on board someone from 482 Forward, who is part of the backbone for our COVID coalition. And joining us now is Arlisa Hurd. Arlisa is the Dynamic Education Director at 482 Forward. Arlisa, let's hear you, please. Your perspective and experiences relevant to racial disparities and COVID.
Thank you, Jametta. And so just a slight correction, I am one of the education organizers. We do have an education director, and it's not me. But thank you. I'll take that as that's a vision that's coming, right?
Absolutely. Think it, do it, is coming.
There you go. Hi, everyone. Once again, my name is Arlisa Hurd, and I am a mother of two sons. Their ages are 25 and 14. And as Jametta said, I am one of the education organizers for 482 Forward. I don't know about you, but I just feel like this pandemic has turned things upside down and opened up eyes at the same time. You know, I have to admit that I feel some kind of way when I hear how Black and Brown communities are negatively impacted at a much higher rate when it comes to disparities in our health, education, housing, unemployment, healthcare, and the list goes on and on. Unfortunately, many Black and Brown people have gotten used to differential treatment. As Christina mentioned, just to hear that, and sometimes it's even expected. We've gotten used to all these systems in our world not working for us or not working with us. You know, I've seen this show up in my personal life with my oldest son. Now, my son, he's 25 years old now, but he was born with sickle cell anemia disease. And because of this disease, my son has had more than 60 hospitalizations. He's had his hip replaced when he was 16 years old. We almost lost him when he was 7. And to this day, there are times when he's in so much pain, because with sickle cell, the pain is so severe that he can't sleep. He's been up as much as almost 2 weeks, unable to sleep for longer than 5 or 10 minutes because of the pain. And he always describes it like, he said, Ma, it's like somebody's repeatedly stabbing me down my spine, up and down, nonstop. And although he suffered and endured so much, and he's overcome so much, that's not the worst part. The worst part is the insult that's been added to his injury. Like many other adults, sickle cell patients, too often they're mistreated, neglected, and disrespected when they show up to a hospital ER. I cannot tell you the number of times that my son has been treated as if he were a drug addict seeking drugs when he presented to an emergency room. But it doesn't stop there, because as you probably know, sickle cell is a disease that affects the Black community, predominantly the Black community. And this is the most underfunded, under-researched, underserved clinics and services. And, you know, in fact, there was even some talk of closing the only sickle cell clinic that services adults right here in the city at some time. Can you imagine closing? And now in this moment of COVID, he has been sick, and he has also been refused hospital admissions, has been even told that he wasn't really sick, he just really wanted some opioids. All of those things, hurtful to my son, hurtful to my family, hurtful to me as a mother, and hurtful to our community. I have always said that every crisis paves the way for an opportunity. And right now, I believe, even in the midst of all of this, that there is something beautiful coming up from the ashes of these moments. The fact that we're talking about how these disparities show up in this moment is a step in the right direction. I just want to make sure that not only are folks listening, but we are in a position to change the direction and how things have gone. Thank you. Jametta?
Thank you so much, both of the parents who are bringing home to us what we are so often overlooking through our own experiences. And like everyone else, like you, we are continuing to work at home to stay safe. but we believe through knowledge, there is power. And so that's why we're going to continue to begin to have this discussion. So we'd like to make sure, first off, that you're comfortable. Hopefully you've had a chance to see our translators. May I ask Saeed if you could come on and tell us your name, please, and give the telephone number for Arabic translation.
إن كنت بحاجة للترجمة إلى اللغة العربية الرجاء الاتصال على الرقم 313-241-7030. الرقم مجددا هو 313-241-7030. معكم سعيد دحدح وشكرا. Thank you.
Thank you, Saeed. And now may we also have ASL, I believe Julie, would you show us the way to go? We have Julie for ASL. Well, I do know, I've seen her there, and so she is helping absolutely. And we would also like to be able to have Spanish translation as well. Christina, if you will.
Sí, buenos días. Me llamo Cristina Guzmán y soy su traductora. Si quieren traducción, por favor, marquen al 626-7440.
Thank you so much. We want to let you know for the audience that we want to hear from you. Before we move into our speakers, we want to let you know that you can chat in the Facebook Live, or you can text us. Text to 313-288-2082. Again, the text number is 313-288-2082. So at this point, we're going to move forward in our conversation with the dynamic leaders and perspectives that we have with us today. And because we're talking about COVID, we've heard Dr. Haley, as I like to call her, has lined up for us an understanding of what are we talking about when we say racial disparities and health disparities. Well, we know this is what public health has been struggling with, in fact, for decades. So we're so pleased to have someone representing our own Detroit Department of Health, and that is Yolanda Hill Ashford. Yolanda is the Division Director for Family and Community Health. Yolanda, welcome, and please share with us your perspective about racial disparities and what you see as the intersection with COVID.
Hi, thank you, Jametta. Again, I am Yolanda Hill Ashford. Actually, my title is now the Director of Health Promotion. And thank you for this opportunity. I'm sorry, I just learned of it about an hour ago. So I will do my best in representing the health department. One of the things that I've been mostly excited about is the, as both of the parents said, is the acknowledgement that there is a huge disparity that we have seen, or that has been exposed. And as you said, Jametta, that we've seen in public health for a number of years. CDC even said that they issued a statement that longstanding systemic health and social inequities have put some members of racial and ethnic minority groups at increased risk. And we live those risks every day. We talk about the social determinants of health, and we know that for minorities where you live, or non-minorities, where you live, play, work, pray, and learn affects your health outcomes. We also are now talking about education levels, access to health, and they're talking about it not just in terms of where facilities are located, but since COVID, they're talking about how people are treated. And one of the, both parents just gave a perfect example of access and inequities that go beyond being able to physically walk into a building. When you're treated less than, and I've had my own personal testimonies of being accused of being on Medicaid and being told I can have an abortion when I got pregnant with my oldest son, and I was, of age. So they said I was 33. And because of my age, I was told you know, you should have an abortion because of a number of things that should go on, and then told Medicaid would pay for it. So you know, with COVID, we've seen all kinds of exposures coming out, and for those of us who have been living it, we're sighing a sigh of relief. We want, and we follow statistics on a basis, and we do look at things from a global perspective as well as a local perspective. So we have been following the hospital cases, and I know Christina was talking about the Hispanic rate of hospitalization being 4 times greater, but with the African Americans, it's 5 times. It's the disparities just grow and grow. We know that the number of deaths, specifically in Detroit, has been horrific for African Americans, especially as we talk about any health disparity, but you know, COVID specifically. We, you know, as of cases of COVID, and we had 1,461 confirmed deaths as of yesterday. African Americans make up 82.3% of those deaths.
Yolanda,
And
could
that
you repeat
is
that?
8 and other races combined make up a little over 10%. Yeah, with the statistics on death, well, we have 12,075 confirmed cases of COVID as of yesterday. And we have 1,461 confirmed deaths from COVID. And African Americans, actually, I'm sorry, I lost my place. African Americans make up 82.3% of those deaths. Is that?
So to our audience,
Okay.
we want to let you know that, Yolanda, could you kindly go back?
At the health department, we really want you all to start to prioritize some things as we are within the health department. So you can, you know, I'm sorry, I can not hear you, Jametta.
Yolanda, unfortunately, we are missing a great deal of your wonderful information and statistics. I think you're experiencing what so many of us are, which is some bandwidth issues that are showing on your screen. If I kick back to you now, can you see how you can do a sum up for us? Okay, well, unfortunately, this is the new world that we're all living in, which is that we are internet dependent. We need multiple devices to do the work. And that includes our health and essential workers as well. And certainly our public health partners and all of those in medicine and support are part of the essential workers that we need to have. We will make sure that you have a copy of the items and the data that Yolanda was so wonderful to provide from the Detroit Health Department. So
yeah,
go ahead. Can you, are you back now?
I didn't realize you guys weren't.
So Yolanda, I think we've lost you again, and only for the interest of time, I so regret. We're going to move forward, and if you get a bit of a better connection, we want you to still stay put, because we have some dynamic speakers and we want to have some conversation amongst the panelists as well as with you, the audience. And again, you can go to Facebook chat to put in your questions or comments. You may also text us at area code 313-288-2082. That's 313-288-2082. So we'll move from that important kind of grounding that we've had, both from Dr. Haley as well as from Yolanda talking about statistics, to move into the other critical area of health, which is nutrition. And it is so important. And we've seen how COVID has ripped off a scab. It's ripped away any veil that people had, that there's not systemic racism that's adversely affecting people. And what does it mean, particularly for our food source, for so many people are dependent. And we're very pleased to welcome back Kirk Hayes. Kirk is the CEO of Forgotten Harvest. Kirk Mays, welcome.
Thank you. Good morning. How are you doing today?
We're wonderful, and you?
Good.
Good.
Thank you for inviting me to the discussion. Clearly, food is a human issue, and it does cut deep into all of our communities throughout Southeast Michigan. But, you know, clearly there were vulnerabilities in African-American communities and just, you know, communities that are underserved throughout Southeast Michigan and throughout the state, actually, well before COVID was on set. And it only actually is exasperated during these times. You know, food, you know, in particular, the space that is my focus at this moment, you know, is the bottom line and the beginning of everybody's day. You know, you gotta have food in order to operate, in order to make things happen. And when the dominoes began to fall, as far as people needing to not only constrict their steps, but also not having as many options of places to go. Plus, you know, jobs are literally having to shut down with many of the people who work in the service world, knowing that many people at the lower stratas of our economy are working in places like in the grocery stores and the retail and restaurants, and many of the places where people are intermingling with each other. As those resources that people are depending on begin to dwindle, and even now we're actually in an actually even more intense time, to tell you the truth, than the beginning phase of COVID, is where people have to start adjusting their decisions about what's important, what things in life that they're going to start to sacrifice, and put the more basic needs in front. And food is primary. So we stand in a space where there's a high level of urgency to not miss a beat, and to make sure that we do it with a level of care and sensitivity to safety, with a broad understanding at this point, knowing that we need to actually operate within the scope of a global pandemic, but at the same time make sure we're on time and food safety is still at a high priority for all of us. So, you know, looking at the cross section of people that we're serving in the community, way too many vulnerable people and from vulnerable populations like seniors, and of course people in the African American community. I mean, quite frankly, I run a organization that's smack dab in the middle of Metro Detroit. We're in Detroit. We serve 60% of what we do to the people in Wayne County and in the city of Detroit. So honestly, after seeing so much need day in and day out, sometimes you forget that it comes in different shades and different faces. You know, this need is actually spanning throughout the region. So yes, in our area, we see some imbalances in general in our society, from just the unfairness of how our society is set up, and people have to start from an unfair point in general. There's a lot of inequities, and we do definitely see that stressing certain communities even more now, especially African American communities and communities of colors in general. But people know how to stick together and how to work together, and I think that's going to ultimately get us all through.
Kirk, thank you. In particular, ending on the note that if we work together, that's our opportunity to do better. And there's this saying, I never really quite get it right, that what doesn't break you makes you. So I think in this moment, just like our Lisa said earlier, we are finding new ways to interact and support each other. I'd like to make sure that I hit pause now to see if we have any questions that have come in through the chat or questions that have come through the text messages for either Yolanda or for Kirk. April, do we have any?
At the moment, we don't. I anticipate towards the end of this panel, we'll have a lot more questions. Thank you.
Yes, thank you, April. I would like to ask one follow-up question, Kirk, if you would. We know there's a great deal of food insecurity, and those are the kinds of drivers that impact people's health and wellness and their immune system, even when we start talking about battling viruses like the coronavirus. Could you share very briefly, during this time of COVID, some of your own stats? How much food have you given out? How have you been able to support the schools? We know we've got 50,000 kids just in DPSCD. In what ways have you been able to help address those inequities?
Yeah, thank you for those questions. We typically, just going straight to this, well, I just started in order. So with the volume, we've gone from, Forgotten Harvest is typically serving about, you can say on an even keel, about 130, 140,000 pounds of food a day on a regular basis. And that's when we're in a 6-day-a-week format. We're up to 200 to 250 plus thousand, sometimes 300,000 pounds of food a day. And we're doing that now within 5 days. So the volumes of food have definitely gone up. The way that we're sourcing the food has changed dramatically. And the way that we're distributing the food has changed quite dramatically as well. So food volumes are definitely moving at a higher pace. And we've had to, with community partners, essentially change the mechanism of food delivery in some respects in order to actually keep up with new food supply coming in from places like, the government program, what we call CFAP, or the CARES Act program, which is giving you boxed vegetables, and then sourcing food from places that we had to buy it in order to make sure we have everything we need in order to give whole meals when people are coming by, or at least enough of the individual commodities that people can go away with groceries, essentially. As far as in that same vein, as far as serving the schools, what we were able to do with many of the other food banks was basically redirect some of the dollars that we already are getting in order to serve like after school food and summer lunches. So, this was, there's programs that already kind of source those kinds of dollars so we could supplement what the schools had. So if you think about it, the money that the schools had for lunch and their meal service, they were converting that to those, meal distributions that you heard the schools were doing. In the same turn, many of the food banks who had programs already were able to transfer those programs into apply those resources into different ways of being able to serve youth and children. So, for instance, in Forgotten Harvest setup, when we did our mobile super site pantries over 15 different areas, when people were coming through those lines, we were asking specifically, because you didn't have to come one family per car, we were asking how many families were being represented in the car, and we were asking how many children were in each of those families. And then for each of the groups that have children, there's a separate distribution for food for children at the end of the line. So it essentially we position the dollars that we're getting for our after school program to make sure that we have food specific for children, like whole meals for children in those bags, so that when they come through for the family, the kids also had something as well, in addition to what the rest of the family had. So, the super sites serve anywhere from 300 to 700 families in the span of like 9 o'clock in the morning to about 1 o'clock is when they shut off. And then we have another shift that goes in different communities, depending on what's the best time, that start around 1 o'clock and goes to about 4 o'clock. So, I hope that's helpful as far as explaining what we've been doing and how we've been doing it. And then if you want more specific numbers, I can get you those numbers by the detail that you can share with the group.
Kirk, I'm sure that there will be some people, because what's so wonderful in this partnership is having Wayne State University. And by having folks who are trying to take an analysis of how this is impacting us as we move forward, and we know that we may have more issues to deal with, any kind of data like that is really helpful. We're getting ready to move forward, but I know there's some more questions. April?
Yes, we've got two questions. One, in terms of Forgotten Harvest, the question is, how long do you plan to support the community?
Well, I guess as long as the community supports us, we're in this together.
You've been around a while. It's certainly a great program, and we appreciate it.
Yeah, so in truth, I heard the spirit of the question, but the heart of the answer is truly what I'm saying. The organization has been around for 30 years. As a matter of fact, we at the onset of this were somebody doesn't expect me to be an actual customer in. We have a world that has a challenge with seeing everybody the same way. That's not going to be something that's going to happen overnight. And I applaud Governor Whitmer for doing her leg of the race to help bring the healthcare sector one step closer to being up to where we need it all to be.
Great point, Kirk. As long as we've got you, another question. Where can we help people with hygiene products and household goods?
You know, there are so many different places now that are making hand sanitizer. So for hand sanitizer, for sure, man, a buddy of mine just started launching a business with that, and I don't got his information yet. I wish I could have gave you the information for hand sanitizer. I'll get that back to you, or put it on the chat before we're done. As far as household goods and cleansers, I would say, you know, the supply chain itself has been really stressed because of, you know, everybody rushing for things. But I know that the retailers are really trying hard to make sure that they keep things up to snuff. If you can't find things that you typically would buy, we do look into the commercial market of products. So if you can get to something that's semi-commercial or something that is a more heavier strength, and you read the directions, and you diversify some of the things that you're using, you might be able to find other options that be as effective or even more effective than your common household solutions. And with a bit of care, you can really get there probably even better than what you get when you just looking for your regular stuff over the counter.
Awesome, thank you.
Hi, this is
Yolanda,
Haley.
a question just came in. Is the health department seeing increases in malnourishment related health problems?
I don't know that. I don't have that information.
Yolanda, do you have that? Nope, we might have lost her again.
Hi, this is Haley. Can you hear me?
Yes.
Hi, I just would like to pose a question. You can maybe give the short answer now. We can get into it later. You know, we started by this whole presentation by talking about the social determinants of health. And certainly food insecurity is one of those social determinants. And I was just curious about your organization's experience with research and evaluation, and how do you see your organization possibly being involved with research around food insecurity in this COVID-19 time and era?
Sure, thank you for that. So we've been in active conversations with Henry Ford Hospital, with University of Michigan School of Public Health, and a number of other institutions, but in particular those two, to further our work of quantifying what food security is as a measure, so that we can actually be able to be held accountable to this idea that we want to start driving down food insecurity. See, we recognize that there's two things that we're looking at here, but at minimum, there's the actual sensation of hunger that comes up X amount of times per day for given a particular person that we all cry that we want to serve and address. But in truth, when you really analyze that whole conversation, we're talking about addressing uncontrolled hunger of people who don't have the resources, who in this country, we should be figuring out a better way to help each other as brothers and as human beings. It's an ethical question, but it's also a very real community question. So the question becomes, are we here to actually make sure we're putting food in the hands of everybody who could potentially be hungry every day, 3 times a day? Or are we trying to get to a place where we can systemically reduce the occurrence of people actually having anxiety because they can't actually find food, and reduce it because we're actually putting systems in place that address information, that address access, and then ultimately address making sure that the things that are actually in the spaces that people can get food are nutritious and bountiful and variety enough that people can actually, can actually take home meals. So the quantification of food insecurity as a quote unquote anxiety, much like PTSD, is something that we've been striving to actually get some quantification around, because it's what's driving the reason for all of our change going forward. So the leaders at the School of Public Health at Michigan have been in this discussion with us. We've worked with Data Driven Detroit in order to create a food insecurity index for Metro Detroit. that we have available and we could share with everybody. It just recently got updated within the last, I think, 6 months. That takes on a number of variables, including transportation, where food is distributed, and a number of other things in order to give us an idea of where people are most at risk for that anxiety based on a geographic piece. So the short answer to your question is yes. Forgotten Harvest is very much so interested in data driving our decisions going forward. We're actively looking for and having conversations with high-end or institutional level partners to help us drive through this. I know this is supposed to be short. As far as Henry Ford goes, we've been looking to figure out how we can work with somebody, maybe even somebody in behavioral health, to figure out how we could actually come up with a study that could actually go into a health journal or something like that. There's been a lot of conversations. They've been heavy, and we're trying to figure out where to find a grip that we and/or our state partners can actually go into something and to help us actually move this conversation forward at a scientific level. Thanks for that question, Haley.
Thank you so much. That was an outstanding analysis. I think this is showing why we want to have this webinar and the one next week. We really want to connect. We need to connect. Researchers and academics like me and April need to connect with people like you. April and I will be sure to connect you. There are many people at Wayne State right down the street who can work with you. But thank you for that. And hopefully we can talk more about it later when at the end of all our presentations. Thank you so much.
Absolutely.
Thank you, Kirk, for reinforcing. Some people are not aware that nonprofits are also interested in being accountable and being data-driven. We just often need partners or tools that enable us to do that. So it's really exciting to hear about you also talking about system change. And when I think about system change, I think that we have been in a 1,000-year war around equity, around access, around justice. And when we think in that kind of prism, there are certain people who come to mind in the city of Detroit. And one of them happens to be Reverend Larry Simmons, who has been a stalwart advocate and activist around the issues of equity and addressing racism, structural as well as implicit bias. So I'm so happy to welcome aboard. Our discussion is Reverend Larry Simmons, who's the director of the Brightmoor Alliance and also pastor at church. Larry, would you come forth, please? Your thoughts about racial disparities and that intersection with COVID.
So let me act out of my prophetic role and ask everybody if they would take a minute and pray with me. Lord God, I come to you today and ask that you would open the eyes and the ears of everyone on this call. God, I pray that the wisdom being shared will be a seed in the soil of hope, and that it will spring forth and bear fruit to a hungry world needing it right now. Now, I pray in the name of my Savior. His name is Jesus, and he is the Christ. But let each of us pray as we believe. And we all say together, amen, amen, and amen.
Yes, hallelujah.
So I start with prayer because my role here is to talk about the church, religion, bias, and COVID-19. So I want to contextualize this in a certain way. When we talk about the church, we have to be clear that there are two different meanings in that term. One is the spiritual. It is where those of us of faith have encountered. In my faith, it's Jesus. In other faiths, it's Allah. In other faiths, in Judaism, it is Tetragrammaton, the name that is not spoken. But for us, and I'm going to speak to Christians because I'm going to be somewhat critical, and I feel authorized to do that because I am a Christian pastor Baber Memorial AME Church. So first we have this spiritual side. This, for me, I characterize as the Jesus talk, as the Jesus study, as the Jesus understanding. On the other side, we have the political economy of the social institution called the church. And that church has a history and a political posture relative to people of color. African Americans I'm talking about today, but really this extends beyond that. And the reason this is important is because in our society in the United States, it has been the church who has framed placed the moral framework around our culture for good and for ill. So I want to look at the political economy of this social institution called the church. Because if I get into the spiritual, that's way more than 10 minutes. And then I got to talk about eschatology, which is the study of end times and theodicy and the significance of the gospel relative to the rest of the Bible. And we ain't got time today for that, but call me, text me. I love to talk about this, but I want to talk about the social impact and how the church helped originate this bias. The church helped originate the bias we live with today. So when you hear that this has been a 1,000-year fight, I just want to carry you all the way back to the middle 1400s, when the Catholic Church, in the biggest act of privilege, divided the world in half through a series of papal bulls. Half went to Spain and half went to Portugal. Now that's what you call having privilege. You are going to sit in one place in Rome and divide the entire planet Earth between two European countries. It didn't last because the political economy of the times wouldn't support it. And I'm not going to just single out the Catholic Church. If you move over to the Church of England, the Church of England provided the moral support for the Atlantic slave trade, which the English came to dominate. I'm not going to stay with the Church of England. I'm a Methodist, an African Methodist Episcopal. My church came out of the Methodist Church because the Methodist Church in the 1700s, about the time of the American Revolution, would not allow African Americans to sit in church with whites or to pray at the altar with whites. So this history, the church created a theology, a bogus theology, that the reason people of color from Africa were being enslaved is because it was God's intent. That was just justification for pre-existing economic reality. If you go back and check, you will discover that the Catholic Church was the largest slaveholder in Maryland, Missouri, Florida, and Georgia. You move forward to the Civil War, and you will find sermons about how the Civil War was a righteous struggle to maintain the dominance of whites. This psyche has integrated itself throughout the American culture. In order to justify what was done to African Americans, a justification had to be created. During the course of this justification, the original images of Mary and Jesus, which were dark complected, got changed and became white and European looking. Don't take my word for it, look it up. Every element of our society was shifted to justify the inhumane treatment. Now, let's move this up to today in COVID. Is COVID racist? Absolutely not. Does it disproportionately affect people of color, black and brown? Absolutely yes. But that's the nature of implicit bias. Implicit bias doesn't have to have a conscious intent. It simply acts on pre-existing conditions and multiplies the effect of it. I like the way Doc put it about upstream causes and downstream causes. So slavery and the justification for it served as the upstream cause. The downstream effect is that people bring us into the hospital and they believe we are stronger than white people. So there are studies which now show that Black people are less likely to get pain medication. This isn't just Larry Simmons talking. This is both Beyonce and Serena Williams talked about this in their treatment. The doc talked about it, our listener talked about it with her son. That bias created by the notion that Africans were beasts of burdens way back in the 14th, 15th, 16th centuries carries forward today and becomes part of the bias that doctors bring into the service room. And that bias has been buttressed by the church and continues to be buttressed today. There's an online amount of time. I'm checking with my time. So give me the high sign if I'm done, because you know I'll talk about this all day. Okay.
Yeah.
So give me the high. Just give me a shout out to Meta when I get near. So I want to bring this up to today. So here's the excuse today that the church is making: that there is no such thing as race. This is a interview done by a prominent church in the South. You can find these things online. Just look it up: the church and racism. Google that. There's no such thing as race all of a sudden anymore. It's not a question of racism, it's a question of sin, and therefore it's an individual behavioral choice. These are all excuse making in order to justify not altering the system created by constructed by obvious bias and continued by implicit bias, and in some cases overt bias. So the police officer you saw on George Floyd's neck, he was simply acting out the behavior passed down from the slave patrols in the 1600s that were built and constructed to repress and oppress slaves and to scare them from fighting back. That is what evolved into the modern police system. And that same attitude that slaves are stronger than white people, that slaves are less subject to getting sick. Do you remember at the beginning of COVID, there was this lie that Black people didn't get COVID like white people did? That's a manifestation of that ancient theology that is now brought into the present. So here's what I would say. To all of us who are people of faith, we have to be courageous and bold in talking about, first learning, and then talking about this to those who are in charge of our faith institutions. We cannot allow the church to continue to frame and justify the abuse of people of color on some bogus theology. Let me tell you what Jesus said. Jesus said when he came to preach, and I'm going to open up the book right here, so don't nobody think I'm making this up. This is from the Living Translation. It says, and I quote, "The Spirit of the Lord is upon me." This is Jesus' first sermon. "He has appointed me," the Lord, the Spirit of the Lord, "to preach good news to the poor. He has sent me to heal the brokenhearted, to announce that the captives shall be released and the blind shall see, that the downtrodden shall be freed from their oppressors, and that God is ready to give blessings to all who come to him." African-American people rescued that gospel from the hands of implicit bias. I'm done. Let's keep the work up.
Absolutely. You were on fire, Reverend Larry, and there's a whole lot of shouting, I'm sure, that's going on out there. And the other important thing is that we're also talking about learning first. We have to learn and understand before we can come up with real answers and solutions. And so thank you so much. And I'm really delighted at this point that we're going to move to trying to hear from someone who's experienced COVID, but also has the experience of being in the political world and looking at legislation and things that can positively or negatively impact racial disparities. So in that, I'm so delighted for us to welcome with us is Representative Tyrone Carter. Tyrone, are you with us? And you turn on your video, please.
Yes, can you hear me?
Yes, we can. Welcome.
I can see you all. And thank you for the opportunity. I was just going over my notes as I was listening to the sermon.
Yes.
Man, I got to go behind that. But anyway, I was looking at my notes. I was looking at my notes and I thought about when it first came about. We had a meeting at the governor's house on February 27th. And we were talking about COVID as it was starting to emerge and what were their plans. And the thing that's interesting about that, a week later, I went to a party where a bunch of us that are retired from the sheriff's department, we go to Burt's every first Friday in March for the last 20 years. And that is the place where I think a lot of us, got sick. Donna Faye Collins passed away. And so when I take steps back and look at how did this happen and how it was treated, I think about some of my friends that tried to go to the hospital that are Black that were told to go home. We think about the Detroit captain that went to the hospital and they told him, "Oh, you're okay." How many other people were sent home because of this bias, if you will? Didn't check them out, didn't do anything. The other thing that I'm working on is we had to jump hurdles to get people tested. So when we talk about initially, my wife and I, we both got tested. She was negative, I was positive. It took us a week to get the results back. So now I know that they've got, better technology so you can get information, quicker. But if we're talking about a week span and I'm still going to work and doing the things that I've been doing, how many other people have exposed to this? So we've learned a lot about this. And I'll say this, I stand behind the governor 100% because she shut the state down. I want to say on the 13th because nobody went to work on the 16th. And I'll never forget it. I was downtown and there's a pub down there that has this huge St. Patty's Day party. They had tents right there across from Fishbones. And that's usually a big deal. Had people been allowed to go and still, just mix with one another, we don't know how many lives would have been touched. But the biggest thing that I'm working on right now is what's next. You get your test, like I got my test. It was positive. You self-quarantine. It's the then what? What are we talking about aftercare? Because as we start to notice that people are coming out of aftercare, like I know I lost 15 pounds and a lot of it was muscle. I'm not as strong as I used to be, but I know some people, a good friend of mine who was at that party, just got out of the hospital Monday. He went last Friday and he said that he had blood clots on his lungs and he has a bone infection. And that is due to COVID. Okay, now that we've survived, because we've got more people that have survived that have passed away, we've got to look at these healthcare disparities, healthcare access, because if you were having issues about getting healthcare before and you received your positive result and they told you quarantine, what's next for some of these people? And I know because I have insurance, I can call and say my doctor's appointment is in August 10th, to give you an idea of how far out we're talking. We have to look at this and learn lessons from accessibility. And like Reverend Simmons said, the disparities. I live in a zip code that has the highest asthma. We're one of the more polluted zip codes in the state of Michigan. So we're talking about being predisposed to issues that already affect your lungs. So I'm looking at this holistically. Now, the problem lies with this, and we're going to be honest on this call. A lot of my Republican colleagues don't believe that it exists the way it does, even though Isaac Robinson, my seatmate, passed away from it. We were in education yesterday, and if you look at the Detroit News article, my Republican colleagues still refuse to wear masks. So wearing masks, number one, is disrespectful, and then you can't turn around and say you're pro-life and not wear a mask to protect life. So there's some issues there. So as a coalition, as a caucus, we're working on legislation to try to change some of these disparities and get healthcare access to communities. The other thing that was large and huge, E-Course in River Rouge, there was no testing done down there at all. So we were able to secure some opportunities with Midwest Health. What is Midwest? I don't want to butcher their name because they're testing people every week. They're going to Coney Islands. They are going to dollar stores. They are meeting the people where they are because people don't have access to internet. People don't have access to transportation. So those are the things that we're working on right now because a lot of people don't have money. And we remove the barriers about healthcare insurance. You got to have healthcare. You got to have prescriptions. So as the Detroit caucus worked on those things, including out at the State Fair, if you remember, first it was drive-through. Everybody didn't have a car. Then you had to have a primary care physician. So we've removed as many barriers as possible. Now we've got to figure out the what's next because this is impacting people differently. If you watch the news, you'll see where I was watching Como the other night. They had a lady on there. She said her lungs don't have the capacity. Her children, 17, had it. They had a gentleman on there one night that said his memory is not as good as it used to be. So after this is over, we've got to figure out how do we care for some of the people who didn't have health care before. And now this is going to magnify and accelerate any conditions that they have. So those are the things that we're working on. It's the aftercare. but I've got to get buy-in from my Republican colleagues. So I'll stop there. I see a hand wave.
Thank you for sharing. I'm sure that we have a lot of questions that are coming in from the chat as well as from Facebook, but I understand there's been some technical difficulties. It's the kind of nature of the new world that we're in. Let me share with you again, audience, you can text us at 313-288-2082. What we'd like to do is just take about another 5 minutes to get any questions for Representative Carter or Reverend Larry. And then we'll move into two final questions that we're like you to probably try to hit hard for 1 minute each. April, do we have any questions in the chat or text messages?
I don't see any at the moment, but I have one of my own. Thinking about the discrepancies we've seen between political parties, but also different populations. One of the concerns I've had is despite how widespread COVID is, it seems to be a fair population who not only has not had it, but don't know anybody who has or anyone who has died. And so they don't seem to believe that it is that big a deal. So I ran into somebody, it was somebody that did some work on my house, and he said, I live right near the fairgrounds. I don't see that line being very big. And I had to explain to him that a lot of people in Detroit don't have cars, and that was a limitation. But how do we reach out to those people who truly don't think it's a big thing because they really haven't seen it affect them or anyone around them?
Well, there's a lot of misinformation going around about, how you get it. And then there's an arrogance of some people. They're still having beach parties. They're still having gatherings. And it's going to take somebody close to them to get it, for them to get it. Because just watching this, I had it. I know 8 people that are in my cell phone that have passed away. Right. So I know the impact. I know that it's real. I still have some of and I'll just be honest, my Republican colleagues that just do not believe. And it reminds me of the crack epidemic and the opioid crisis. When it was crack and it was in the Black community, it was like, okay, just say no. Then when it became an opioid issue and it hit suburban areas and different pockets, all of a sudden it's like, oh my God, we got to get rehab. We can't send these people to prison. So the different responses are based on their beliefs and their choices. And when they have the power to make decisions, I don't pray that anybody gets it before they get it. But if that's what it's going to take, then we'll have to hold our breath. Because the simple thing about not wearing a mask yesterday in a educational hearing, when we're talking about kids going back to school, there's a picture, like I said, my Republican colleagues, only one Republican had a mask on.
I would add this, and I'm going to come from the faith base now, and I'm going to talk about prayer. There are moments in our history, in American history, where we have been pressed against the wall as a few. And one of the things that I believe has been the prophetic role of African Americans in the history of this country is to bring to the fore, to bring up and clearly the power of faith. Because I'm telling you something, every device conceivable by humanity has been thrown against people of color. Part of the reason that we are seeing this resistance is because there is an implicit bias in the way election representatives are selected. So while you have, and you help me with this, Tyrone, I think 70%, 60%, something like that of the votes went to Democratic candidates in the last state representative and state Senate races. The majority of people who were elected were Republican because the boundaries were gerrymandered to undermine the impact of Democratic votes. So a majority of the state, and this is all I want people to be clear about this, 70% of the people in this country believe that this pandemic is serious. 30% don't. It fluctuates plus and minus 3 or 4. Here's the deal. that 30% elect a disproportionate number of representatives in legislators. So one, I'm going to say pray. And number two, those of us who know about this, we're going to have to go to those who are elected, tell them that this matters to us, and it's going to be a decision-making criteria going forward. And then we've got, and I know y'all not going to want to hear this because this is another discussion, but then you got to trust God. You got to keep working and trust God. It's like planting a seed. You can't see nothing going on. You water it, you water it, you water it, nothing's happening. And then one day, boom, up out of the ground pops a shoot. We've been talking about police, and I'm going to stop, police injustice for years. It didn't look like anything was happening. And then God rest his soul, George Floyd was murdered on Memorial Day. And those seeds planted through all of that struggle and work over all that time erupted across the planet as a statement against injustice and police brutality. So don't quit working, don't quit explaining, and trust that in time, that seed is going to grow and bear fruit.
And just know that I have a House bill addressing what you just talked about.
There we go.
And that's exactly the kind of thing that the COVID Coalition is about, is to get information, share facts, and then how do we translate that into collective action? We're getting down to the end of the program. I can't believe this. April, I'm looking at the clock and it looks like we've only got about 13 minutes. Okay. I know that there are some ending questions that you had one, and I believe that there was another one that I was to pose, because we really want to hear from you as well, some action steps. Tyrone, you gave us some, but April, are there any action steps or questions towards that you'd like to pose? And this
there
will
is
be
a
to all of
question
our panelists.
Yes, there's a question just came in from Representative Carter. Is the legislature considering adopting standards for PPE like masks to ensure the population uses the best possible protection?
I don't know that for sure. I think in the beginning, it was just to get PPEs. I know that the N95s are the best masks, and people are getting face coverings. That is a great question. I can find out the answer for you, but I know that when I went out and personally got 10,000 masks for the county jail, the police departments, we made sure, because they were first responders, that they had the N95s, which block out 95%. Now, the other one are the surgical masks. So it's a different mask. And that is a great question. What is the best everyday mask that, we can find? I know that some places use the mask and the shield. So I can find that out for you.
Okay. So some of our final questions, and I think you brought up a really good point, is looking at what happens to survivors, the long-term health needs. And those are where some of our research will come in our next session next week. Hopefully we'll hear from some of the research that are looking into that. Let's see, a couple other questions just came across. Can you speak to the recent efforts to bypass the CDC and go directly to HHS with COVID hospital data?
Would that one be for me? I can find out, because we've been in session, and right now the biggest thing is education about, students going back to school or not going back to school. So I can find out those, and I'm sure that we have a package of bills that are based on our values of making sure that people are protected. So CDC, the governor has been on point, so I can check with her staff and see if we can get that information to you.
That'd be great. So some of our follow-up questions: what can we do now in Detroit and Michigan to mitigate the virus and address the underlying economic and social determinants of health?
Well, the first thing I say to people is responsible people have to hold our irresponsible relatives and friends accountable, because all they do is create more rules for us. And I'll give you an example. You've got a 23-year-old son that thinks he can go and do whatever he wants to do. And if he doesn't leave the house with a mask, he can't get back in the house. It's that simple. So we're responsible, and all they're going to do, irresponsible people, and we see them all the time, just, gently persuade them to, hey, wear a mask. It'll save lives. It'll protect us. Mm-hmm. So I mean, the government can't do it. The police can't do it. We who are here every day have to talk to people that we know, love, and they trust us and say, hey, just wear a mask. That's all we're asking.
Okay. What are your thoughts or recommendations for the upcoming school year?
Personally, I'm a no right now. I'm a no because I look at it this way, and we worked on criminal justice reform. One of my House bills was to let people who are frail and sick come home. So you notice they've been releasing prisoners. My request when you release a prisoner is that you test him or her and make sure that they're negative, because you may be sending them to a home that has 4 generations. They may have a great grandmother, a grandmother. So we're talking about people who may be susceptible to this. And we're talking about kids. Kids go to school and kids are strong, and if they've got everything going, but you got to remember the lunch lady, the janitor, the bus person. It's more than just kids and teachers. We've got to look at this on a whole spectrum and say, how do we best protect folks? And if we see another spike, then I'm a no. I mean, we've got to figure out a hybrid way. If 2 days a week people go, depending on where we are in the levels. But right now, we don't have a vaccine. We don't have anything in place to protect us. And we're talking about the whole state. But I have Ecorse River Rouge in Southwest Detroit, and they barely have enough money for the minimums. So if we're talking about sending kids and putting them at risk, then we're talking about a whole community. So I'm a no.
Dr. Haley Thompson had a question.
Yeah, thank you. So I know we don't have a lot of time, but I wanted to return to this issue, and I kind of put it out. I want to be very straightforward about it. We're here in Detroit. Where this whole presentation is in partnership with Wayne State University. So you have experts, right? Quote unquote experts, PhDs, MDs, and so on in your backyard, right? Who we're, top research institution. We can bring a lot of things to the table. And particularly when it comes to research and COVID-19, where would you like this to head? How can you see partnerships develop? Where do you think the research dollars need to go? Because I will tell you, someone who applies for funding from the National Institutes of Health, there are millions of dollars in emergency funding coming down through universities to deal with COVID-19. What kind of research do you think is important? This is for all the panel members. What kind of research do you think is really key in Metro Detroit? And how do you see partnerships working between community and Wayne State University or any academic institution?
I'm a graduate of Wayne State University, and this is a sore point for me. And I've had the pleasure of speaking with the president about this. I don't think Wayne State University has anything near the kind of footprint in Detroit that it ought to have. It needs to be partnering with community groups like 482 Forward, like the Brightmoor Alliance, like the Detroit 21, Detroit Parent Network. There are all of these activist institutions. I mean, you can pick whichever end of the political activism spectrum you want, from the moderate, very moderate, to the ultra radical. But getting academics to come out of their ivory tower and to come down on the ground where all of those ideas transform into behaviors, it is extremely difficult. So I would love to speak with you as a leader of community of impact organizations about how we can work together to get the university to do this. I'm going to end with this quick story. I used to run the information technology department for Wayne State. I'm a graduate of their computer science program. I called and wrote and visited to try to get them to partner with Wayne County to do technology training. I could not get a phone call back. As a graduate, as an alumni of the department, as a senior executive in a major government institution, I could not get a call back from them. What you just said is a sore point for me. So if you've got an idea, I'll be glad to partner with you to help make the point with whoever we can or need to get them out of those walls and down onto the street.
I would suggest that as Wayne State is one of the top 3 research universities, we have Michigan State, U of M, but I agree with Reverend Simmons. Their footprint in the city of Detroit, and especially since the way that COVID hit Southeastern Michigan, I think they have a huge opportunity to research what happens afterwards, because we've got far more survivors than we have that people that have passed away. And we're learning that this virus is affecting people differently, depending on, you know, their health, depending on their environment. So it would be interesting to find out what we don't know. And the more you talk to people, the more we see that it's impacting people differently. Because when my buddy told me he had blood clots on his lungs and a blood and a bone infection that was due to COVID, that was 3 months ago. So we still don't know the long-term effects. And I think that would be a great start for Wayne State. I think they're still partnered with one of the hospitals, and they have their own medical school. Well, that's who tested me. It was the Wayne State physicians. So there's a huge opportunity to do what's next.
And we have a great partnership with the Department of Education, the School of Education, through their research collaborative, Detroit Education Research Partnership. But it's the only one. I mean, it's too rare. Now I can tell you, and I'm not going to do it, there are at least 10 partnerships the University of Michigan has going on in Detroit that I know about. And I don't know them all. I don't know anything near them all. But I'm around this entire city, sitting on boards and coalitions, and I can name you one from Wayne State. So let's talk. Teach us the inside politics over there. We'll work on the outside with you.
Yeah.
Trust me, I'm working on it. I'm working on it. Thank you.
So as we look at that, we're about to the 3-minute point. What I'd like to do is if we could do a quick round robin of our panelists and even parents. If you could identify something that you believe will be powerful, relevant to change, whether it's individual behavioral change or systems change, because racial disparities will continue as long as we're not talking about what are we going to do differently. Could we go around and hear your thoughts? City of Detroit, right now, we know we're having an uptick. That's an outcome, but we know that disparities are at that institutional and systemic level. What is something that you recommend that we should talk about and move on? 1 minute each, or whoever wants to take that on.
Jump.
I better go before him because he'll take all 3 of my minutes now.
No, I'm gonna take 1 minute. Repent, and repentance means changing your behavior, become anti-racist, not just not racist.
Well, I think it starts with an intellectual conversation that has nothing to do with race, but about fairness, equality, and equity. I've tried to tell people that everybody's entitled to that, even though some people don't believe everyone is, even people that you don't like. So we've got to start there, because at the end of the day, if it hits other cultures, we'll see a different response. But I don't have time to wait for them to be a part of this. We need it right now. And Detroit is one of the cities that I believe that we can do it.
Yolanda? Yeah, we hear your phone. There you go, come on.
I would like for, a lot of us has talked about personal responsibility and calling out each other, but I'd like people to start thinking about the dissonance that has been created in society about races and different people of minority status. Start to check our thoughts and our beliefs and our implicit biases. And on an organizational level, I would like for all of us to take some responsibility on calling out resources that aren't shared in an equitable manner. People think they're doing justice when they serve things in an equal way, but that's not what's needed. What's needed is equity. And so I would challenge us to think on those levels.
Excellent. So we've heard some of that being, some of the solutions is having an equity lens that we apply to everything. It's not enough just to talk about structural racism. We have to talk about purposely and intentionally being anti-racist. And we recognize that even an implicit bias, while it may be implicit and it may not be intentional, there has to be accountability systems. So when that is being put onto our community, there's some resolution. I believe that I'm one of our parents, are Lisa or Christina. Any closing words for us?
I couldn't seem to get off of mute.
Okay.
The only thing I would say is I would like for us to just love one another a little better. And I'll leave it at that.
Okay. Thank you. And so that's a perfect ending because there's so much wrapped up into that word love. We would love to hear from you, your evaluation of this discussion. You'll see on the screen now that your feedback is important. Please complete the webinar evaluation, and we'll make sure that the information that our speakers provided will be available to you. And so with that, I'm going to ask everyone if you would turn on your screen so the audience can see everyone. And we would love for you to know as an audience that we are here. Thank you to Wayne State University and to Carmanos Institute for partnering with us in the community to begin to have meaningful and in-depth discussions about how research that is grounded in community and equity can make a difference in the city of Detroit. Goodbye, everyone. Thank you.
Now imagine thousands of families gathered on both sides of Werner Highway waiting for the Cinco de Mayo parade. Let's visit a page from last year's Cinco de Mayo
are you
parade.
the one
This next segment is prepared by the Comité Patriótico. Georgina Garcia and Latinos in Michigan promised to take us to the center of the action.
Mexicans have been in Detroit as early as the 1890s. Since the turn of the century, the number of Mexican immigrants coming to Detroit to share in the promise of a better life has greatly increased. In 1929, a group came together to discuss the formation of the Comité Patriótico that would maintain and promote the cultural traditions of their home country and help those in need. Over the decades, the Patriotic Committee has helped Mexican immigrants transition, recognized Mexican national holidays, religious celebrations, and hosted numerous cultural events in Southwest Detroit. The Cinco de Mayo parade that travels the 3-mile stretch of the Latino business strip along West Werner Highway includes hundreds of floats, marching bands, mariachis, charros, floats, and vehicles decked out in Mexican attire and costumes. These activities also add to the economic vitality to the business community of Southwest Detroit.
Para la comunidad latina es muy importante el 5 de mayo y son tradiciones de México y tratamos de venirlas a ponerlas aquí en Estados Unidos.
Many people proud of their Hispanic heritage met at the Werner Highway waiting for their chance to take part in the parade, while hundreds of spectators from Detroit and other parts of the metropolitan area wait along the sidewalk just to soak in the gorgeous weather and the festive atmosphere.
Y bueno, toda la comunidad se junta para celebrar nuestra patria y la cultura mexicana, latina, que somos tan orgullosos.
To participate in the Cinco de Mayo parade has become a yearly tradition for many Hispanic businesses and their families. The Cinco de Mayo parade has become part of the Hispanic community festivities in Southwest Detroit. Regardless of nationality or language, in Southwest Detroit, the Cinco de Mayo parade celebrates the rich diversity of the Hispanic community.
One more reason to keep positive, and certainly an event to look forward to in 2021, is the Cinco de Mayo parade. I, for one, am ready to join the Cinco de Mayo parade next year and to perform until my shoes break. As we saw, the event is a kaleidoscope of culture, tradition, art, and community. One of the artists who bring all these elements into her work is Gloria Rocha, through her ballet folklórico Raíces Mexicanas from Detroit. Next is Gloria Rocha, Gabriela Stubb, and Jose Perez with their take on the meaning of folk Mexican dance, better known as ballet folklórico.
Southwest is, you gotta live it, man. You gotta come over here, visit. Plus Detroit,
it's a melting pot.
It's like a pot of gumbo. It really is, and a lot of that has to do with, like in this area, you have a lot of people that are from Jalisco, Guanajuato, Zacatecas, Michoacan. The thing about us all living here is we're all from a different place.
We teach and choreograph folklorico dancing, and we perform throughout Southwest Detroit.
Folklorico dancing is the interpretation of Mexican culture through dance.
A lot of people here, they leave Mexico and they can't go back, because of their different, status as an immigrant. Depending on the region, you have a different set of costumes, different set of steps that is all influenced through historical interpretation.
And influences.
And influences. Chihuahua is very Polish. The music there, we dance the actual polkas. So you see the influence there that it's European, but Chihuahua also has the indigenous side. Honestly, you can have a state, but have at least 8 different regions in the state.
You get to be from that person, from that region, from that state for 3 or 4 to 10 minutes on stage, and it's very overwhelming sometimes, and it's very beautiful at the same time. You get to impersonate the person that came from that place.
It's amazing to be so far away from home and to still see it represented here and be able to provide that platform for people, because when we perform for people from these different states, it takes them back to where they grew up. It takes them back to, going to the plaza, which is the local park with their grandparents.
The art of dancing is something that everybody appreciates. It brings back memories. It can be done in the street, in a parking lot. It can be done in somebody's house.
The art of folklore is representing the spirit of the Mexican culture.
It's time to continue our journey through Mexico and visit its capital, Mexico City, the largest city in Mexico and the most populous in all of North America. This impressive city holds the ruins of pre-Hispanic cultures of the Templo Mayor, the Metropolitan Cathedral from the time of the conquest, and the Palacio Nacional with its impressive murals by Diego Rivera.
Yes, this is for I don't have information with me. Yes, so yes, but the apps. That's the information that I
Yes. Thank you.
Mexico City was where muralist Diego Rivera met the iconic Frida Kahlo. Both traveled to Detroit in 1932, leaving a legacy of what we commonly recognize as the Rivera Court inside the Detroit Institute of Arts. Dorotea Chodzica, assistant curator of modern European art at the DIA, is here with a message about Frida Kahlo. 3 important works from Kahlo are visiting the DIA until September 2020. Let's take a listen.
Hello, I'm Dorota Chudzicka, Assistant Curator of Modern European Art at the Detroit Institute of Arts. On the occasion of the Cinco de Mayo celebration, on behalf of the DIA, we would like to wish our Mexican-American community in the Detroit area and elsewhere a very happy holiday. Since we cannot invite you to join us in person at the DIA galleries, we want to bring to your home a highlight of our latest Guests of Honor exhibition series titled Frida Kahlo and Salvador Dali. The selected painting from the exhibition is Frida Kahlo's Self-Portrait with Monkey, painted in 1938. It is on loan from the Albright Knox Art Gallery in Buffalo, New York. Frida Kahlo is one of the most celebrated Mexican artists, recognized worldwide and passionately admired for her art as well as her unique personality and style. Kahlo was born in 1907 in La Casa Azul in Coyoacan, at the time a village on the outskirts of Mexico City. We hope to see you at the Detroit Institute of Arts when our museum is open again, and encourage you to see Kahlo's exceptional self-portrait with monkey for yourself. Before we reopen our doors, please visit us on our website to learn more. In the meantime, be well and be safe, and happy Cinco de Mayo.
Happy Cinco de Mayo indeed. Muralism has been a preferred art form of Mexican artists since the 1920s. It is an art that is easily accessible and shared with the community, providing a perfect canvas for social and political commentary. And Southwest Detroit is home to many beautiful murals. A special thanks to local artists and community leaders, Amelia Duran from Art on the Block and Garaje Cultural, as well as Juan Carlos Duiki Perez from Featherstone Moments. Each shared videos and photographs of these wonderful Southwest Detroit murals. Just as powerful as the murals located throughout Southwest Detroit is the voice of the Latinx community through their spoken word. Joining us tonight is Reyes from We Are Culture Creators, a media arts collective and label featuring some of Detroit's best young talent.
Los creadores, un colectivo de artes de medio.
Welcome from the We Are Culture Creators House. My name is Reyes. You can find me online as Reyes Poetry. I'm a spoken word artist. I do a lot of work in the community around arts and entrepreneurship, and I want to share a poem with you on this Cinco de Mayo. So, as you can see, we're in the life of COVID. I have a mask on, got my little We Are Culture Creators logo. But I want to share a piece with you that really talks about the long-term kind of work we have to do. This piece is called Plant Seeds. And to me, as somebody who works with young people, with somebody who has worked in the activist community, with somebody who has worked in our community to see long-term growth, a lot of times we don't get to see the fruit of our labor. So I want to share with you a story that is from the Zapatistas. It's an old Mayan kind of like story, parable, myth, whatever you may want to call it. It was translated from the native language into Spanish, and then it was translated from Spanish to English, and then hopefully I turned this into some hood English. So the story is called Plant the Seeds, and it goes a little something like this. So long ago, in a village, there was an old man, and he would plant seeds, and every day he would plant and plant and plant. And people would look at him and ask him, how can you plant seeds that you know won't grow in your lifetime? And it didn't matter to him. He would just plant. And they would call him the crazy old man and ridicule him and make fun of him. So one day, this old man died and passed away. And a few generations later, some children went into the mountains and they saw this beautiful garden, this beautiful forest that was growing. And they asked themselves, how could this be that this beautiful garden, this beautiful forest is growing where it shouldn't be growing? And so they ran back to their parents, and their parents looked at this beautiful garden, this beautiful forest, and said, we have to find the oldest relative. We have to find the oldest person in our village to see where this garden came from. And so they found this woman, and they asked her, how can this garden be? How can this forest be growing in the mountain where it shouldn't be growing? And she thought about it. And she thought about it. And she said, oh, I remember it was this crazy old man, this man, we used to call him the crazy old man. And so after a short conversation in the community, they decided to celebrate this crazy old man. Because in the winter, the wood from the trees kept the community warm. The roots allowed the plants to grow, and you could grow fruit and vegetables. And the canopy in the summer, it kept them cool. So even after all this time, and this man that was ridiculed and called crazy, and just continued to plant things that he knew he would not see grow in his lifetime, he was able to affect his community. And so I tell you, plant seeds of resistance, no matter how small or feeble they may be. Plant seeds of change. Let them grow to cover our pain, our sorrow. Plant seeds to unify the peoples of the Americas, the people of the world. Plant seeds to grow a canopy of change, a rainforest of hope, a flower of love, a garden of peace. Plant seeds for justice and equality. Plant seeds to grow a flower of love, a rainforest of hope, a garden of peace. Plant seeds for justice and equality. Plant seeds for the indigenous rights. Plant seeds for toils for those who struggle. Nurture and love them so they may grow. Let's plant seeds for the children that may eat of its fruit, so it may cleanse our bodies, so it may heal us. Plant seeds so our air may be clean. Plant seeds so we can drink fresh, sweet water. Plant seeds to destroy imperialism, global domination, allow its branches to break through. Allow the concrete and twisted steel to be broken. Plant seeds so we can dream of a new world. So when it's leaves, we can hear the joyous voices of freedom. So when it's flowers, we can see the world's beauty. So in its flower, we can smell the sweetness of a new world. So we can dream of a new world. So when it's leaves, we can hear the joyous voices of freedom. So when it's trunk, we can stand firm on who we are. So when it's branches, we can feel its reassuring strength. So when it's trunk, we can stand firm on our history. So when it's roots, we can remember what we have forgotten. Plant seeds, nurture them, love them, water them. Plant seeds and let them grow. Let us plant seeds in the rest of the world to be an example of what is possible. Plant seeds, plant seeds, plant seeds because it is necessary. And as we celebrate Cinco de Mayo, it's important that as a community, we plant seeds of change. We plant seeds of resistance. No matter what we may think they may be, large or small, plant seeds. Thank you, Detroit.
Thank you, Reyes, for reminding us of the power of small deeds and how these small deeds do have a multiplier effect that may shape the future for an individual, a family, or the community at large. Next, Gabriela Santiago Romero will join us with a message from Southwest Detroit Community Cares. Welcome, Gabriela.
Hi, everyone. Thank you so much for having me and for putting this together. It's really beautiful. I'm sad that we can't be there together, celebrating together. My name again is Gabriela Santiago Romero. I'm here as the Policy and Research Director with We the People Michigan and a proud member of the Southwest Detroit Community Cares Group. So as soon as COVID hit Michigan, I immediately thought about our neighbors and our people and what that would mean to have this virus in our community and to have everything shut down. It would mean that people would need food for rent, money for food, money for rent and food, need support. And we immediately got together and started to raise funding and put together what we are calling the Southwest Detroit Community Care Group. So we've been able to raise over $40,000. All of the money is going directly back to our neighbors in Southwest Detroit and neighboring communities like Lincoln Park, Melvindale, River Rouge. We are able to provide up to $300 to families, and we're also providing groceries and diapers for families that need it. We are also still collecting donations. We hope to raise at least $50,000. Although we've raised this much, we still have a lot of more people to support, and anything goes a long way. We are going to raise our goal to 50 soon. So if you go to chuff.org/project/support Southwest, you're able to donate, and soon we are going to raise our goal to 50,000 in order for us to support more families. We've been able to provide over 100 families in and around Southwest Detroit with funding or groceries or diapers, and we hope to grow that. If you need support or if you know someone that needs support, please give us a call. Our phone number is 734-506-6649, and we have about 20 of us from the community. Many of us are community organizers, community members. We have folks that speak Spanish and Arabic. So if you need someone to speak to in those languages, we got you. And again, this is something that we put together as community members when we realized that we were going to need each other to support each other during these times. So thank you so much to everyone who's a part of the group. It's been really beautiful to see. And please, if you can support, donate $5, $20 today for us to be able to continue to support our families. And again, I'm sad that we can't be here together, but I'm so proud. And of course, our community would still come together this way to celebrate ourselves and to support ourselves. So thank you for having me, and thank you for doing this. I will see you very soon, hopefully. And please reach out if you need any support.
Thank you, Gabriela. Would you do us a favor and remind us once again, what is the website and the phone number where folks can reach to make a donation?
Sure. So if you would like to donate, the link is there on your screen, and the website is chuffed.org. It's spelled chuffed.org/project PRJECT/support Southwest SUPPORT That's to donate. And if you need to call for support, the phone number is 734-506 6649.
Thank you so much. Thank you so much for
Thank you.
joining us. Now, our last segment in our journey through Mexico City centers on the international and interactive exhibition, Los Trompos, coming right up. Now, for Los Trompos, it was funny because I was just teaching my friends this week about how to play Mexican loteria, and the word Los Trompos, or Los Trompos came up. And so, for those of you who don't know, in Spanish, for spinning top. Now, Los Trompos is created by Hector Esguaje and Ignacio Cadena. This art installation premiered at DTE Beacon Park for its inaugural Cinco de Mayo celebration in 2019. The DTE Beacon Park Foundation brought Los Trompos direct from Mexico City to Detroit to encourage play and imagination amongst guests of all ages and to share and celebrate Mexican culture in an interactive and inclusive manner. This collection of 8 three-dimensional, larger-than-life spinning tops transformed Beacon Park into vibrant space that included specific events with 4th graders from Cesar Chavez Academy. Shout out to Cesar Chavez in Southwest Detroit. Seniors from La Sede, Latin Americans for Social and Economic Development, and other Detroit area senior programs, and a hands-on architectural workshop with the public. DTE Beacon Park hosted Los Trompos to engage the rich and diverse cultures represented throughout our Detroit communities. Through the act of play and exploration, visitors experienced art while interacting with people. DTE Beacon Park looks forward to bringing Los Trompos back to the space in 2021. I can't wait. And to expand engagement to even more people and communities across Southeast Michigan. We'd like to give a big shout out and thank you to Meg Hedges, manager for DTE's Beacon Park, for sharing this story and for the support she provided to this virtual event as we continue this virtual journey through Mexico. Our last stop, Jalisco, Mexico. That's right. See you soon in Jalisco. It's coming right up. We're just pausing for a minute. Don't go nowhere. We want you to stay with us. Please stay with us.
Technical difficulties.
Stay right with us. Don't go nowhere. Ophelia, how you doing?
I'm good, thank you. Just here reminiscing, like Gabby's saying, missing not being to be with the community. I'm a performer too, so first time in years that we haven't been able to perform at all. So yeah, it looks like we're ready to go.
All right, here we go, Jalisco.
¡Ay, qué bonito camina, chiquita! Y muévele, muévele, chiquitita.
We are live. Welcome back to the 16th COVID313 Community Coalition for Families and Students Teletown Hall. I'm Christine Bell, the mother of 3 awesome children. I'm honored to serve as the Executive Director of Urban Neighborhood Initiatives and proud member of COVID313 Community Coalition for Families and Students. I am today's moderator for the town hall, and we are bringing you a diverse group of leaders in education to discuss the plans for our schools reopening. We're also translating the town hall to Spanish and ASL. We unfortunately are not able to have Arabic translation today. We want to give time for folks to get on the right phone line and get comfortable. Cindy, will you please share the phone number for Spanish translation?
So, this is Cristina. Para la traducción en español, por favor, puede hablar al 313-626-7440. Sus traductores el día de hoy son Gloria Rosas y Cristina Ruiz Mazón. Muchas gracias.
Thank you, Christine. I'm so sorry. Thank you. Katie, please share the instructions for ASL. Thank you, Katie. And as always, we want to hear from you. You can chat your comments or questions in the Facebook chat, or you can text them to 313-288-2082. Again, that number is 313-288-2082. To get us started today, please welcome the wonderful Alyssa Hurd. Alyssa?
Thank you, Christine. That was such a lovely intro. Hello, everyone. Again, my name is Arlisa Hurd, and I've been with you all for 15, 16 weeks now. I am a mother of 2 sons, and I am also a member of this coalition and a member of 482 Forward. Well, here we go. We are here now, and things couldn't be any more chaotic, and I really mean that. I have a 14-year-old son who is set to enter 9th grade this fall. And these last few months, he's been home, away from school friends. He's had to graduate virtually. He had to do schoolwork virtually whenever I could pull him away from the video games. And in fact, I think he even did some of his chores virtually. And I'm sure most parents know what I mean by that. But I've watched him go from being comfortable doing nothing to being mad about doing nothing, to being afraid to go outside or be around others, to wanting to stay outside and toss the football around. He used to ask every day about school, but now not so much. And in a way, I'm glad he stopped asking, because I just didn't have any straight answers for him. I really didn't know. And I don't think anyone has a straight answer. In fact, I have a whole bunch of I don't knows. I don't know if I want my child to go back to school yet. I don't know if I can support him academically at home. You see, he needs special academic assistance. He has special ed services, and I'm not equipped to provide that. I don't know how to measure his learning loss. I really don't. I don't know what this whole thing has done to him emotionally and mentally. I don't know enough about what this virus can and cannot do. I don't know if he'll be safe in a classroom with other students and a teacher. I don't know if schools have enough protective equipment. I don't know if school buildings are clean enough, sanitized properly. I don't know what happens when a teacher or fellow classmate gets sick. I don't know if virtual learning is in my son's best interest because of the way that he learns. I don't know who has the best plan or who has the safest plan. I just want to let you know that today, this parent, and I'm sure I'm with many other parents, we just don't know. Well, I'm going to end it there, but I also want to, I am acting as a little bit of a co-host today. So I just want to encourage folks to stay with us for the next 60 minutes so you can stay informed and stay powerful. This is also a time for you to ask experts your questions and have a little fun. To ask your questions, please use the chat on Facebook or text your questions to 313-288-2082. Again, that's 313-288-2082. We will have a Q&A after each segment. If we can't answer a question today, we are committed to getting the answers to you by early next week. All the questions asked today will be posted with answers on onedetroitpbs.org. Cindy, could you please share the Spanish translation number for our folks that have just arrived?
Sí, this is Cristina. Para traducción en español, por favor, conéctese al 313-626-7440. Una vez más, 313-626-7440. Sus traductores el día de hoy son Cristina Ruiz Mazón y Gloria Rosas. Muchísimas gracias. Thank you.
Thank you, Christina. We're so used to having Cindy today, and Christina is here today. So I thank you so much, Christina. I apologize for that. For our experts, those of you that are on the panel, please, please, please remember to speak slowly for our translators. They want to make sure that they are translating the important information that you are sharing, and they want to translate it correctly. Also, to the speakers, turn off your camera when you are not speaking to ensure that our ASL interpreter can be seen. And please, please, please mute yourself when you're not speaking. We have a timekeeper today, and the timekeeper will chat you your remaining time. And if you go over your time, Christine or one of the other moderators will gently remind you to wrap it up. Okay, we will be taking questions from our audience at the end of the segment. And now I'm going to hand it off to Christine. Christine?
Thank you so much, Arlisa. So again, if you have questions, please put them in the Facebook chat. We've got folks moderating that, or you can text them to 313-288-2082. Again, that number is 313-288-2082. We have moderators that are both transferring the questions from text and the Facebook chat to me today. So please make sure you share your comments and questions one of those two ways. So today we have one very important segment on the reopening of schools. And Arlisa, I think, did a beautiful job of really laying out how chaotic and how many unknowns there are at this moment. And we hope today that the expert panelists that we have brought will help us to answer some of those questions and feel a little more at ease. First, we'll have Brandy Johnson, Policy Advisor on Education and Workforce for Governor Gretchen Whitmer, to discuss the governor's strategy to reopen schools. Brandy?
Great, thanks so much for having me. Good afternoon, everyone. My name is Brandy Johnson. I'm the governor's education policy advisor. So I just wanted to spend a couple of minutes talking about the process by which the governor put forward a plan that we call the My Safe Schools roadmap. First and foremost, the governor is committed to protecting students and educators from COVID-19. In order to develop the plan, we brought together a diverse group of stakeholders, but also experts to help develop recommendations that resulted in the roadmap. We brought together public health experts, a pediatrician, mental health experts, teachers, administrators, parents, a student from DPSCD, school board members, and community leaders to develop the comprehensive plan. The roadmap is a 63-page document for districts to use that provides both a set of mandates as well as strong guidance on the use of PE, good hand hygiene, cleaning and disinfecting protocols, how to handle transportation, athletics, and more. Alongside the roadmap, the governor also announced that she was allocating $256 million above and beyond current levels of funding to support every school's ability to implement the plan. The roadmap has a robust section on students and educators' mental health and wellness, and recognizes that that is just as important of an issue as the physical health and wellness of students and educators, and provides guidance on how schools can address this issue. We're really proud of the plan we put forward, and we think that it will help districts across the state protect students and the more than 100,000 educators who are dedicated their lives to helping our students grow. The governor has talked a lot about how it is our fervent hope that we are able to return to face-to-face instruction. At the outset of establishing the advisory council, we agreed that our first and foremost preference is that students are able to go back to school face-to-face. That being said, particularly as we've seen an increase in the number of cases in the last week or so, the governor has also said very clearly that if it is not safe to return to school, she will feel comfortable making that tough call. And so that's why over the next 6 or 7 weeks in particular, we are very, very focused on maximizing the chances that schools can reopen for face-to-face instruction. And that's why it's so important to remain vigilant about our facial coverings requirements. Right now, the region where Detroit is in phase 4, which does allow for face-to-face instruction with very strict health and safety protocols that are required for every district to implement. Should we go to phase 5, districts will have some flexibility to implement a health and safety plan that fits the community, and school boards will have to adopt that plan. If instead we go backwards to phase 3, which is the last thing we want, then schools will again go back into a remote learning posture. We will continue to rely on data and science and recommendations from health experts to protect Michigan families from COVID-19. And our plan again was first and most rooted in that public health data. We monitor that data closely, and we are doing everything we can to lower the chance of a second wave. And then the last thing I'll say is that in order to best support districts, we recognize that additional federal support in the form of funding is necessary. While we were able to allocate $256 million to help districts implement the roadmap, we do recognize that that's not enough and more is needed. And so we have constant daily calls with our congressional delegation and are hoping to work with our representatives and senators in Washington, D.C. to get the funding that we need really for next school year to help support, and preventing any budget cuts. We need Congress to pass additional financial support to states so that we can ensure that education is properly funded. So with that, I'll stop and be happy to answer a couple of questions.
Do you have questions? Please.
Christine, you're on mute.
I'm talking over my phone, Molly. Can you hear me?
Yes, yeah, now we can.
Okay. All right. Thank you, Brandy. We want to remind everybody that's watching that you can ask your questions or share your comments in the Facebook chat, or text your questions to 313-288-2082. Brandy, we actually have quite a few questions for you. The first question is, what is your personal thoughts about children going back to school? Do you think that we're prepared to send children back?
Yeah, and I represent the governor, and so tend not to talk about myself personally, but I will say that I have a son who's about to be 5, who is going to be starting kindergarten in the fall, and I can only imagine. Well, it's not that I can imagine now these really tough decisions that families need to make. I'm now in that position. I do feel confident in our district's abilities to make schools as safe as possible, both for the children and for their teachers and educators and support staff that are so important. And so I do feel confident that schools have what they need and really robust plans that will maximize health and safety for our school communities. But at the same time, I also have a lot of respect for families that aren't confident, and we need to make sure that they're receiving appropriate remote learning services so that their students can still learn from home. And then I also recognize that there are children that are immunocompromised or otherwise at higher risk. And again, really respect the parents and families who are making a different decision.
Thank you. Okay, so is the reopening committee mandating schools to work with doctors? What happens if schools don't have enough money for PPE?
Yep, so what the executive order does is, and the roadmap is, require that districts work cooperatively with their local public health departments that are staffed by medical experts and informed about the latest around public health. There was a pediatrician that contributed greatly to our to the roadmap, as well as an external expert, Dr. Mario Ramirez, who is a medical doctor but has a background in pandemic response and infectious disease. So the roadmap was developed based on the recommendations of medical science, and we're very, very proud of that. I think that there have been, as I mentioned, resources dedicated resources from the CARES Act, Coronavirus Relief Fund dollars direct to districts to help them support PPE purchases. And so, and we want to work with districts to make sure that they have what they need. And then I do also know that there are some corporate and philanthropic organizations that are ready and willing to step in to support districts buying both the PPE, but I also think it's important to also note the necessary cleaning and disinfectant supplies, as well as hand hygiene supplies, which are also just as important. And so I think that there's a commitment to ensure that districts get what they need.
Great. We have a few more questions for you. When do schools have to send their plan, and who reviews the plan?
Yeah, so the school board is the one that ultimately reviews and adopts the plan. The school board, the locally elected school board or appointed school board in the case of public school academies, is the one that will be reviewing and adopting the plan. The plans are due in mid-August or 7 days before the start of the school year. So for districts that are on balanced school calendars or year-round school, where they do start before, well before the traditional day after Labor Day start, their plans need to be adopted and posted transparently to families at least 7 days before school starts, or by August 15th, whichever one happens sooner.
Great, thank you. Until we know that our children are safe by returning to school, as a grandparent and a youth leader, I know that it is not safe for our children to return to school at this time. I volunteered in the schools last school semester, and a teacher had the virus. We were quarantined for 14 days. How many people in the schools have been affected, and why hasn't the public been notified? And this is
Sure,
from a grandmother.
I can't speak certainly to the answers about that, but I would encourage consultation with the local public health department. So Detroit's local public health officer, Denise Fair, actually chaired the Return to School Advisory Council's public health subcommittee, and was a really integral part of developing the roadmap. I would maybe suggest her as a phenomenal resource and thoughtful expert on these types of issues. And as I mentioned, what is required for districts is a very tight coordination between the district and the local public health department. In this case, it is the City of Detroit's public health department, and led by Denise Fair, who would help develop those protocols for, if and frankly when someone in the school community tests positive.
Okay. So will standardized testing be suspended for this year?
That's a super good question. We don't know the answer yet. What we do know is there's multiple levels of requirements for assessments. There's a requirement from the federal government that the state do assessments in order to access federal funding. And then there are state requirements for assessments for accountability purposes. What we have done is sent a letter from Superintendent Michael Rice to U.S. Department of Education Secretary Betsy DeVos requesting a federal waiver. So if we know that there is not that federal requirement, we can then talk about it at the state level in terms of making the decision that's right for Michigan. If they deny that waiver, we don't have the luxury of putting those federal resources at risk. And so, we'll see. This is a debate that is happening very an open debate in the legislature right now. I can safely say that it won't make sense to administer assessments remotely. So if and when we are in a remote posture, or if there is a surge and we do go back to learning from home, there is not an expectation that assessments be administered remotely. And we'll need to work with the legislature on that, or ultimately issue an executive order, but we have some options there. Our hope is to continue having this discussion with our legislature and come to, a reasonable agreement. So but we need to wait to see what we hear from Betsy DeVos, and then we also need to see if we're actually in school or if we're not in school come assessment time before we make that decision.
Great, thank you. There's a couple of questions around testing, and so I'm gonna try to combine them. So will students and teachers be required to take COVID tests? If so, how often? And will there be free testing for students and teachers?
It's not a requirement. And again, that is something yes, there are absolutely free options. But again, that is something I would encourage on maybe the next version of one of these town halls, that Denise Fair, who's the public health expert, could field some of those specific questions. It's not a requirement. What the roadmap discusses is really daily self-screening. So there's a strong encouragement that, parents check their kid for symptoms of illness before they come to school, and ultimately keep kids home if they're sick, and the same thing with teachers. But the recommendation is a real strong self-assessment.
And Brandy, as we learn more about the virus, because we're really actually learning about the virus in real time, but as we're learning more, do you suspect that some of and I'm thinking specifically about students or teachers that may be asymptomatic, do you think at any point that the state might make it a requirement for testing to happen as we learn more about the virus and how it's spreading?
Yeah, I think we're really open to adjusting the roadmap as we learn more. As more and more medical studies are done about various mitigation strategies, it will adjust, I think, where we emphasize requirements. And so I think the governor is open to additional feedback. So one example that I would give is we've heard a lot of disappointment or nervousness about some extracurricular activities like choir and band. And so at this point, given what we know today, it is not safe to do those activities without facial coverings indoors. As painful as that may be, it's such an important part of a child's educational experience. As we learn more about something we're looking, we would be open to reconsidering.
Okay, so the questions keep coming in, so we are definitely going to have to send you some questions after this is done. But I definitely want to get this one in live, because I think many of our families are thinking about this. But what specific recommendations or best practices does the state have in place to support the needs of special education students whose parents do not feel comfortable sending their child to school for in-person learning?
Yeah, that's a great question. So the roadmap that I mentioned has special considerations for students with special needs. And I would also expect that the Michigan Department of Education will issue supplemental guidance on the issues that are really heavy on the hearts and minds of families and special education educators. What we know is that the student's IEP is incredibly important to this process. And so the student's IEP team needs to be fully engaged and in the process, intimately involved in the process of making changes to how services are delivered. And that's really, really important. We had a special education administrator on the advisory council, and he and I are working closely together to develop additional guidance. I think it's important to note that even if some of the modes of delivery of services need to change due to the nature of COVID-19, those services need to be provided nonetheless, as dictated by a student's IEP.
Great. Thank you so much, Brandy, for being with us today. And there are a few other questions that are rolling in, and we'll make sure that we get those to Brandy so that she can answer them. Thank you so much, Brandy.
Thanks. Have a great afternoon.
Move on to you too. We're going to move on to our next speaker. There should be a survey that was posted in the chat. If you fill it out, you'll be entered into a raffle for a $25 gift card. And so up next, we have Rajrishi from Grand Valley State University to talk about school opening from the school authorizer perspective. Again, if you have questions, please put them in the Facebook chat, or you can text them to 313-288-2082. Again, that number is 313-288-2082. Rajrishi?
Good afternoon, everyone. Thanks for having me here today. It was great to hear from Ms. Johnson from the state and really provide some great clarity on how this process is working. And we appreciate the clarity that's come out of the governor's office as well, so that we can support our schools. As charter schools are navigating this very unfamiliar terrain, we all have the same concerns as have been voiced on the questions, and we've heard throughout it. And that's obviously, we want to make sure that we are providing education for our students that meets their needs while also keeping them and their teachers and their families safe. And so there's this balance that we're all trying to work towards, and using the roadmap have some good ways of sort of balancing that out. As we all know, that if we are in phase 3 or below, all instruction must be remote. So our schools are planning for those kinds of circumstances. We hope we don't get there, but if we do, we want to be prepared. So part of how our schools are doing that are using the continuity of learning plans that we used for the later part of last school year, really looking at those closely, surveying our families, surveying our students, surveying our teachers to find out what worked and how do we improve on the things that we need to improve upon so that we can do an even better job should we get put into that situation this year. We are also expecting, and again, hopefully this doesn't happen, but we are also expecting that we may move from one phase to another. And while it's our hope that all of our movement is forward, we also recognize that it is possible that we could find ourselves starting in one phase and moving backwards. So again, we don't want to get caught unprepared. So we're encouraging all of our schools to prepare for all these options. As we move into phase 4 and in-person schooling becomes an option we can carry out, we're helping our schools really think through what does that look like. And based on the guidance from the roadmap, we know that it looks different depending on how old students are, the way that students are educated, the size of the school. All these things need to get taken into consideration as we think about both the education and the health and wellness of our students and staff. So to that end, you have school staff, you have boards, you have teachers, and you have community kind of coming together to create comprehensive plans that meet the guidelines that the governor's roadmap has laid out. Through that process, we are encouraging our schools to continue to communicate with families and parents and also continue to survey them. What we know is, I think what we heard Arlissa say in the very beginning, for many of us parents, we don't know yet if we want our students to go back to school. I can tell you for me personally, with a rising kindergarten student, I kind of go back and forth on a day-to-day basis depending on what I'm hearing. And we recognize that that's how many families are feeling. That said, we also want to make sure that we are preparing ourselves so that we can give families confidence in whatever they do end up choosing. And so if students are going to come back to school, we want to give you the confidence that we have thought through all of the details and can present, a way of schooling that keeps kids safe while also educating them. To that end, we are also working with teachers on professional development and providing services to help them teach in this kind of environment. We are working with school leaders to ensure that they are aware of any changes in rules and expectations so that we can make sure that they're focused on the right things. And we're working with our boards to ensure that they understand their role in the governance of how these plans are executed. As you know, charter schools are each independent entity, so there's not one centralized place where decisions are made. So it allows for schools to really look at their school community and do what they believe is best for that community. So if you're a parent in a charter school system or a guardian or a grandparent, our best advice to you is to continually stay in touch with your school to find out what the plans are and also to offer your feedback and support. We want to hear from you so that we can make sure we're meeting your needs. Part of choosing a charter school is choosing it on the basis of what that school has to offer and how it matches your student. And we want to continue that as we move forward into these unprecedented times. And so the process for charter schools is very similar to what Ms. Johnson mentioned is the process for all schools, in that we as an authorizer are working with our boards and sort of helping them will come up with their plans and reviewing them for compliance and sort of ensuring they follow the rules. Charter boards then have to pass those plans as a part of their own governance actions. And then they are resubmitted to the state through our office. And so, as she mentioned, all of those plans need to be submitted and approved by August 15th. And they need to be posted to school websites and submitted to the Department of Education by August 17th or 7 days before school starts, whichever comes first. So again, as a family member or parent, you can go on your school's website by August 17th and see the plan that has been put forth, the full plan. And of course, you can always stay in touch with your school to ask them questions and give them feedback throughout. The thing that we need to really get prepared for is the students, because this is a big change for them. And so as parents, again, one of the things you can do is just help talk to your students about what their school year might look like, what the expectations are of them. If they are at an age where a face mask is going to be required, have them start practicing to wear that so that they can become familiar. I mean, we all know that when things are new, kids play with them and they tend to be, feel more like toys than something, but eventually they can get used to something like that. And so we encourage you to help our students just become ready to enter into whatever kind of environment, is offered. And again, we encourage parents to give feedback and exercise their choices as we get closer to September. But it's our hope that we can provide support and good communication so that we can help them do what's best for their students.
Thank you, Radrishi, for being here. And we're going to take questions at the end of this segment. So we're going to go on, and we'd like to welcome Alice Thompson, CEO of Black Family Development, who manages Hope Academy in Detroit. Ms. Thompson?
And I don't see her on as right now.
Okay.
But
All right, great.
Board member Stallworth.
What's that, Molly? Yep, member Stallworth is here. So let's move on to hear our voice from DPSCD. Member Misha Stallworth, assistant, who is a member of the Detroit Public Schools Community District School Board, is here to talk about DPSCD's reopening plan.
Sure. Hi. Thanks for having me today. I think that so there are a couple things. Obviously, unlike some other districts around the country and even in our state, at DPSCD, we have started summer school. We really thought that it was critical to utilize this opportunity to really maximize it in terms of making sure our students are not missing out on educational opportunities. From my personal perspective, there are a lot of things about the last few months that have just been lost educationally for our students, which is something that they cannot afford, especially given kind of the circumstances that we're coming out of as a district and what our students really need. So after surveying parents and seeing that there is an interest in summer school, both in virtual and in-person summer school, we did pull that plan together, which similar to what you've already heard is in line with the state and in line with the governor and those phases. Parents are given the opportunity to register their students for virtual learning or in-person. They're able to make that decision for themselves. And then within that, summer school is educating a much smaller community of students than our typical school year. So we're looking at about 1,000 students compared to the 52,000. We have about half who registered online, about half who registered in summer school. And then in terms of who's actually been attending, those numbers drop a little more. And then in terms of what's happening in person, we are doing symptom checks at the door. Folks are being provided with masks and gloves and the things that they need. If you've seen the photos online, you'll notice that within a classroom, folks are distanced. You might see, 4 students kind of at desks separately with the teacher. And so we've been really doing our best to make sure that everyone is protected, that we're being preventative, that we're mitigating risk. Our bus drivers have been tested before they're able to drive the bus. Same with our teachers. They have to have negative tests ahead of the start of school and coming into buildings. And so it has been, a really challenging process, a really challenging decision to make moving forward. But, we see school as an essential service. And again, given where our students are coming from, I mean, we've had a tremendous amount of growth over the last few years, but growth is not proficiency. It's not saying that our students are exactly where they need to be successful in their future. So, you know, our goal has been to keep students and staff and families safe while also making sure folks have access to the education that they need. Moving forward, you know, in terms of a reopening plan, and I think the word plan is really critical. You know, it can change. It is flexible. It is intended to be responsive to whatever is happening around us, and to do what we need to do, again, to keep folks safe. But as we move forward, the plan is designed to, right, currently, alongside the state of Michigan, with a trajectory of moving towards fewer and fewer cases in our state. Now, if that changes, again, the plan will change. So as we get back into schools, we've been looking at staggered schedules, kind of like block scheduling, but in terms of actual attendance to a building. So if students and families decide to attend school in a building, you might be in a building on, you know, Monday, Wednesday, Friday, and other groups of students might be there Tuesday, Thursday, so that we can reduce the total number of students that are actually in a building at one time. Similar structure in terms of classrooms, in terms of limiting the number of students that are in the classroom at one time, and continuing to work with our partners, to work with the city, to provide testing to families and students. Right now, tests still are not as widely available, or and the results are not as rapidly available as is really effective for kind of day-to-day work, but we want to make sure that that stuff is accessible, that folks can get it, and then as the tests improve, then we'll be ready to step into more of a facilitation role in terms of actually testing students more regularly. But for now, we're facilitating the process of getting tested and making sure that our staff are being tested if they before they enter buildings, as well as making sure that they quarantine if they start to show symptoms or if anything comes up in that way with COVID. So that's kind of the high level rundown of what's going on with reopening at the district. Again, it really is focused on the fact that, you know, in our lives, if you go into this world and you cannot read, or you cannot do basic math, or if you have not developed these skills, you are at a higher risk for homelessness. You're at a higher risk for incarceration. You're at a higher risk for other things that, you know, can kill you, first of all, but also that drastically impact the quality of your life. And so as an educational institution, we have to both be planning and responding to the current moment of safety, and also thinking about the future and the lives of our students and families in that way as well. So those are the things that we've been balancing while also meeting the state requirements. So it's a state requirement to have a reopening plan, and meeting the state guidelines on how you do those things.
Thank you, Member Stallworth. It is a complicated endeavor, and just like it is for parents, it sounds like it has been for the district, trying to balance all of the priorities and importance, and everyone's staff health, students' health, while thinking about all of what you just beautifully laid out. Rodrishi, if you could come on as well, I'm going to start to go through the questions, because I think there are questions that are appropriate for both charter and public. I did want to share a comment and let folks know there are a lot of comments in our Facebook chat, and we're going to share them with you about hybrid versus all virtual versus all in person. But I did want to share this one comment that that somebody put into the chat. Can you push for DPSCD to either do 100% virtual or 100% in person? No hybrid model. Please do not make my kids go risk themselves at school and then still make me have to figure out how to work from home certain days. School is childcare for working parents as well as education for students. 100% in or out, no hybrid model. So that's just, I'm just pulling one of the comments out, but there are many in the chat. So going through the questions, is it possible to offer training to teachers during this summer on how to do virtual learning? For example, tips to keep kids engaged, best ways to do videos, classroom management when it's virtual, etc. So I guess the question, is there a way to do that, or is that happening currently?
So I can answer for charters that absolutely it's happening. I think you have individual schools that are doing it. I know that as an authorizer, we have held several training sessions and had, you know, not just over the summer, but throughout this period of remote learning. And I would say that, you know, we have seen every one of them full because teachers are really looking for this kind of guidance. And so absolutely, and that's a big part of making this entire sort of venture successful, is investing in the teachers, because this is definitely something that's new for them. You know, if you haven't done this before and taught virtually before, it's more than just learning how to, you know, click and upload. It's about understanding how to engage, how to motivate students, how to present things in a manner that is understandable to them, both, you know, sort of like this, where we're synchronous, and if they have to do something on their own, how do they navigate through all of that? So it is complex. It's not impossible, but it is complex, and it's something that the summer has allowed our schools and our teachers and our entities to kind of take that time to invest in them so that they feel more comfortable. Like any professional development, it's never done. Because kids' needs change and the circumstances change. And as you get good at one thing, we want you to get better at the other. So I expect that this is something that we will see continuing on. And I know that in our office, as we're planning our professional learning for the year, we are expecting to do a lot more of this. And once we kind of see how schools are structured, we'll structure our programming so that students can, so that teachers can participate.
Yeah, so some similar things at DPSCD. The minute that we had to transition into virtual learning, the training started. You know, we talk a lot about the technological needs of our students and families at home, but we also have teachers that did not have everything that they needed to make that transition, or that weren't used to using the technology in that way. And we wanted to make sure that we were supporting them so that they could be successful in their work. You know, all of our teachers want to engage with their kids, want to make sure that they're there and in their classrooms and leading their classrooms well. So it's up to us to provide the tools and training to make sure that that's possible. So that training started right there. Also, summer is like professional development season for DPSCD in terms of getting ready for the upcoming school year. So all of those needs are integrated into that training as we move forward, and, you know, continue to think about, let's say the pandemic ended tomorrow. Now that we've done all this, you know, how does virtual learning continue to be integrated in what we're doing? So that training is really important, not just for the current moment, but also as we're being future minded and forward thinking about things. The other thing I just wanted to say to the comment that you shared is that the district will be sending out surveys to families to try and get input on how we'll continue to plan for the fall. I'm going to keep emphasizing plan, because I think we first of all, we all know best laid plans, right? And second of all, it is just that, a plan. So we will change it. It will get updated. It will be modified. So definitely look out for that survey, because we really welcome and want your input.
True. What was planned 2 weeks ago is different this week, and so it sounds like both the charters and DPSCD are of the mindset that this has to be fluid and evolving. I'm just going to ask a few more questions. So will you review your plan at the next DPSCD board meeting?
So we don't have the agenda for August's board meeting yet, but we are planning an August town hall. The date is being coordinated right now, to make sure that as many board members as possible can be there and all those things. So the date is being planned right now for August for us to have a town hall about the reopening plan. Also, it'll give an opportunity for the community to hear some of the data and some of the background information that has been considered thus far, will be considered in the future, and give folks an opportunity to give their input once again on the plan. So as soon as we have that date, we'll make sure 4824 gets it. Of course, it'll be sent out to all of our families. I hope you've been getting our text messages. You should get a text message about it, and we know that for sure. And then as the agenda is developed for our August board meeting, I'll be able to share then what all is on it as well.
Great. So there's a question about, it says, how is summer school going to work? We know that DPSCD has already started summer school. So do you want to very briefly share how that is working currently? And Rodrishi, I'm not sure if you can share kind of a broad stroke of how it's working for the charter schools, but go ahead, Member Stallworth.
Sure. So I think I mentioned what we first did was offer families the opportunity to register for summer school online or in person. Of the families who signed up for summer school, about half elected to go in person, about half elected to go online. Summer school is being offered to high school and middle school students. High school is a lot of credit recovery, middle school enrichment, in ELA, English Language Arts, and mathematics. And then in terms of protocols, students are socially distanced, protective equipment is provided, masks, things like that. Students also have received training on health and safety considering COVID, as well as teachers. And again, all staff who are interacting with students had to receive a negative COVID-19 test before they could begin work. And also they had to receive those results, I believe it was like a week before they started work, so that we made sure we had all that information in the system and in their files. That's kind of the high level of how it works. I'm not sure if the person who asked the question was looking for something more specific, but right now it's half online, it's half in person, at certain buildings, and with enough spatial capacity for individuals to spread out and not be too close to one another.
So with respect to charters, I believe most of our schools either opted to not offer summer school this summer or are doing it virtually. I do know that there's some enrichment classes happening at various schools virtually. And so, I think though that for the most part, that's the way that the charters have opted to do summer school this year.
Also, I said middle school and I meant to say K-8. I apologize.
Thank you. So there's quite a few questions about testing and social distancing and what those requirements are. We're going to make sure that we get those answers back to the folks that have asked them. I'm going to ask one last question to both of you because I think it's important. What doctors are reviewing and advising on the plans that schools are making in Detroit?
Which doctors? With the district itself, first, there are requirements for our reopening plans. They had to be approved by Wayne Risa and by the state. And so just by virtue of that approval process, you're having the review of the state health officials looking at things and making sure that it's in line. And then in addition to that, as we received input, there are members of, part of advisory committees, things like that have offered input. And then finally, not a doctor, but we have really, really benefited from the leadership of Iris Taylor being our board chair, who comes from a health system background. And I know a lot of folks know her for her leadership at DMC, but she started as a nurse in that environment. And so we also have really been, and has continued in that work with Wayne County Mental Health Authority, on advisory councils at the state level on health. She's been like right there at the front of the state level planning and insight around this pandemic. And so we've benefited from having that connection from the state to the district and all of that health information through Dr. Taylor. And then, like I said, the state system was already set up for approval of our plans in that way.
Yeah, I'd echo what Board Member Stallworth said, that the system is set up so that there are sort of approvals down the line. You are also required, the safety requirements include having a workforce safety plan, which takes into consideration recommendations made by folks from the medical and occupational sort of end of things, and also strong collaboration with the local health department. So, that's kind of how schools are incorporating some of that. And again, as Brandy mentioned earlier, there were physicians and people from the medical field on the return to school advisory committee itself. So many of the recommendations in there already have those pieces in it. Anecdotally, many of our schools also have people from the medical field either on their boards or as parts of sort of their consultation teams. So I know that schools are sort of reaching out within their community also to get additional input. But I would say that the majority of the input is going to come from the local health department and other sort of state entities, so that there's consistency across the schools and that we're all kind of using the same information.
Thank you, both of you, so much. And because we have so many questions coming in, and I'm sure as the week goes on, parents and students are gonna have more questions. Would both of you join us next week for the town hall to continue this conversation?
Sure.
Yeah, I'd love to.
Great.
And also, if you are able to share my social media, I'm happy to engage with folks directly if they want to shoot me questions. I'm on Instagram. It's Misha is just cool with the K. I'm on Twitter, Misha Stallworth. I'm on Facebook. If you find me anywhere, I'm happy to engage with you directly.
Thank you so much, Member Stallworth. And we'll make sure that we get your social media handles out to folks. And thank you both so much for being here today and agreeing to be here next week. So it's time to wrap up our town hall. There's a survey that's being posted in the chat right now. If you fill it out, you'll be entered to win a $25 gift card. We want to thank all of our panelists that were here today, and we want to thank each of you for joining us and asking the tough questions and sharing your comments. If we didn't answer your question today, we will make sure that we get them answered, and we will post them next week on onedetroitpbs.org and on DPTV's Facebook page. If you'd like regular updates, fill out the form that's in the chat right now, or put your email or phone number in the chat, or you can text it to us at 313-288-2082. Again, that phone number is 313-288-2082. We also are still planning on doing these weekly, the town halls weekly. However, the programs will be shorter to better accommodate families and to make sure that you get the best information in a shorter period of time. And per usual, we have a few asks for you today before you go. First, we ask you that you please visit Vote 411 to register to vote online. The online registration deadline in Michigan is July 20th. That's Monday. You can register in person up to August 4th, up until the August 4th election at your local clerk's office. But in order to register online, you must register by July the 20th, which is Monday. Voting is incredibly important, so please, if you haven't registered to vote, please do so. Second, please fill out the parent survey that's in the chat right now. This is from 482 Forward. It should take 2 minutes to complete. And the survey is 482 Forward's community survey about reopening schools. We really want and need to hear from you about how you're feeling in this moment about schools reopening. So please fill out the survey. It's in the chat right now. It'll take you 2 minutes. The last thing that we have is that there is an iParent survey, and you can fill that out as well, and we'll make sure that we get it out, that it's posted where you can get to it, because I'm not sure that we actually have it to drop it into the chat right now, but we will make sure that we get that to you. Again, that's another survey to gather information from parents about what they need in relationship to childcare as we go forward this summer and into the fall. We also want to hear specifically from you about what you want to hear about during these town halls. What topics or experts do you want to hear from? If you have an idea of what those things are, what those subjects are, or who those people are, please put it in the chat right now or text us at 313-288-2082. The town hall is truly a group effort. So before we go, can we please have all of our partners turn on their video? Thanks, everybody. And we want to remind everybody to stay healthy, stay powerful, and stay strong. Christina, can you share that in Spanish?
Manténgase saludable, manténgase poderoso y manténgase a salvo. Gracias. Thank you.
Thank you so much, everybody. Have a great weekend.